Good morning to our friends on the West Coast and good afternoon to everyone on the East Coast. I'm Dr. Sam Joaquim, Chief Dental Officer for Zufall Health Center, and I welcome you to today's webinar. Before we begin, a few housekeeping items. Participants will enter the session on mute to avoid any background noise during the presentation. Today's webinar will be broken down into a 50-minute presentation by our guest speaker, followed by a 10-minute question-answer period from the chat, moderated by our Chief IT Officer, Brian Wang. So please feel free to chat in your questions during the presentation. Questions that are not addressed during the session will receive a response directly to the email account associated with that question. If time allows, we will also take a few live questions at the end. You can raise your hand at that time to ask your question and you will be unmuted. Today's session is being recorded and a link to the video as well as the slides will be sent out to participants next week. CE credit is only available for those who attend the live stream and remain connected for at least 45 minutes. Viewing the recording only does not qualify for credit. You will receive a SurveyMonkey link following today's session. It will pop up automatically once the webinar is done, so please stay logged on and don't close the webinar window on your screen. Please complete the survey to receive your CE certificate if you are requesting dental credit. Make sure to enter your name as you want it to appear on the CE letter with complete words and capital letters where applicable. CE certificates will be sent out the week of May 25th. Zufall Health will be offering a series of CE webinars over the next few weeks, and you are invited to attend. Next slide, please. Support for this Zufall webinar series is provided by the Horizon Foundation of New Jersey. Next slide, please. We are pleased to be joined today by our guest speaker, Cathy Butler-Witt. Cathy is the Assistant Director of Public Health Programs at the Southern New Jersey Perinatal Cooperative and Family Health Initiatives. For 19 years, she has focused on tobacco and electronic nicotine delivery system cessation, education, training, and implementation of treatment and policy for providers in New Jersey. She is a seasoned trainer on the new generation of tobacco addiction vaping and the CDC's evidence-based best practice brief intervention model, Ask, Advise, and Refer. Cathy holds a master's degree in human services and a bachelor's degree in social work and a national certificate in tobacco treatment practice. I turn it over now to Cathy.
Thank you very much and good afternoon, everyone. I just want to make you all aware that I work for a grant called Tobacco Free for a Healthy New Jersey, and we are funded by the New Jersey Department of Health, Office of Tobacco Control, Nutrition, and Fitness. I was asked to add several slides regarding COVID-19, smoking, and vaping. My first slide is from the World Health Organization that states that smokers are likely to be more vulnerable to COVID-19. Just the act of smoking when the fingers come to their mouth increases the possibility of transmission of the virus because of that motion. Smokers may also already have lung disease or reduced lung capacity, which would greatly increase the risk of serious illness. Conditions that increase oxygen needs or reduce the ability of the body to use it properly will put patients at higher risk of serious lung conditions such as pneumonia. And this slide just shows you a picture, an infographic that is available from the World Health Organization website that you can print off and use at your facility. In addition to the World Health Organization, the CDC, as of April 2020, lists smoking as a condition of immunocompromised. And you can see the circled smoking. That center picture, I actually just enlarged of the infographic that again you can find on the CDC's website that gives the correlation between smoking and COVID-19. From the University of California, San Francisco Center for Tobacco Control Research and Education, they're quoted as saying, based on what we know about smoking and vaping, it has a whole range of adverse effects on your respiratory system that increases the likelihood of you getting infected. There is evidence that cigarettes weaken our immune system and limit lung function. According to their study, people who smoke e-cigarettes also face a significant risk of developing severe chronic lung illnesses such as asthma, bronchitis, and emphysema. So now let's move forward and talk a little bit about electronic nicotine delivery systems. Electronic nicotine delivery systems are also known as e-cigarettes, vape pens, hookah pens, tanks, mods, JUUL, etc. On the right-hand side, the graphic shows the different products that this describes. All of these products are battery-powered heating devices. They were originally designed to deliver liquid nicotine to users in the form of an aerosol instead of smoke. The aerosol comes from heating the liquid nicotine as well as flavoring. This slide gives us a graphic of the generations of these products and how they've evolved over time. The United States first saw the products come into our states in 2007. All of them were disposable, one-time use, what's called cigalikes. These are e-cigarettes that delivered nicotine and were, again, disposable. Then, to the right, quickly became variations of these products. So variation of these products included products like e-hookah and rechargeable versions, and you can see the difference in size. These products can be recharged, and they also can be refilled. And in the center of the screen, we have vape pens. These have batteries that can reach higher temperatures. They also have refillable e-liquid cartridges and allows users to regulate the frequency of the inhalation. Because these batteries reach higher temperatures, there is more being delivered into the lungs and deeper into the lungs as well. And then the next one over to the right are called mods. These are very large size, sometimes as big as having to put a lanyard around your neck to use them. Their tanks are extremely large, they hold a lot of liquids, and they even heat hotter than the vape pen version. And again, what that means is that these are breathed into the lungs a lot deeper and faster, and therefore delivering the chemicals into our blood system quicker. And then all the way over to the right is a more recent trend, very popular. It's called a pod-based system. These are oftentimes shaped like USBs. They contain pods with higher amounts of nicotine than previous generations. So I'm going to just talk a little bit more about these pod-based systems. Over here on the left-hand side, this graphic is the most popular versions of these pod-based systems right now. These pod-based systems can be refillable, as in this one. This is their tank right here on the top, if you look at my cursor. And then these systems are pre-filled with the intentions of throwing out these mouthpieces when the liquid is finished. However, a lot of users have learned how to adapt these and can actually take off the cover and refill them to get more use out of each of those pods. So a pod mod is an e-cigarette or vaping product with pre-fillable or refillable pods, and they're also modifiable pod mods. There are other examples of the fourth generation devices. Pod mods come in many shapes and sizes and colors. It's appealing to a lot of users. They're much smaller than the tank versions and hold more nicotine. Common pod mod brands are JUUL and Soren. These are very, very popular among our youth. And one of the biggest reasons is, again, because the size of them can be very easily disguised in their hand. They are compatible pre-filled pod cartridges that come with nicotine, THC, or CBD oil without the flavoring. So what's happening, what that means, what's happening is that these pods are now being made as an aftermarket product that contain these other liquids that get put into, this is the piece that you hold on to, and this is the piece with your heating. This piece here actually is what goes into your computer, and this attaches to it, and that's what heats it, that's what recharges the battery. So in addition to making it a little bit easier for the user, smaller, easier to conceal, the other thing about these pod mods is that typically they're used as inside as nicotine salts rather than a free base nicotine used in most other e-cigarettes or vaping products. These nicotine salts have a lower pH than free base nicotine, which allows high levels of nicotine to be inhaled more easily with less irritation to the throat than free base nicotine. So this is a cooler product, it's easier to inhale, it goes down our airway a lot easier, and delivers that nicotine into the blood 2.5 times faster than other e-cigarettes that do not use these nicotine salts. So let's continue to talk about the ingredients a little bit, and I want to call your attention first to this right-hand side of our screen. You can see here that the images that we have very much attract youth. So we have cereal, cinnamon cereal, we have a strawberry fruit flavor, we have a pancake flavor, and we have a popcorn flavor. E-liquids contain propylene glycol or glycerin and other flavors. The end manufacturers claim that these ingredients are safe because they meet the FDA regulation of generally recognized as safe for food additives. However, they are not approved for inhalation, and therefore the effects of these ingredients are still very largely unknown. However, we have been seeing lung inflammation disease similar to the disease popcorn lung that was found years ago in people that worked for a factory that was putting butter flavoring on microwave popcorn without having a respirator on. And those employees came down with an illness that was then determined was from the inhalation of that butter flavoring. And we now are seeing a very similar disease from all of these flavors that are put into these products. 75% of the e-cigarette flavors tested actually had diacetyl. So ENDS aerosol is not just water vapor. If you've ever seen any of these products, particularly the liquids that you can get in a jar, and you move that jar around in your hand, you can actually see what's in there coating the outside of the jar as almost like an oil-based substance. Labeling right now is not a reliable indicator of nicotine content. And the reason is because the FDA still has not mandated how the labeling of these products has to happen. They are working on that since 2016, but it has not been finished yet, those regulations. About 99% of all e-cigarettes sold at convenience stores, supermarkets, and similar outlets contain nicotine. We've also found that they contain cancer-causing chemicals, heavy metals such as nickel, tin, and lead. Some of those metals actually come from the heating coils. So when a person breathes in, they are breathing in sometimes the inside of the products that are heating their liquid. As we talked about in the previous slide, we have the flavorings, we have ultrafine particles, we have organic, volatile organic compounds, and nicotine. So the reason why it's important to talk about this next slide, the cycle of nicotine addiction, is because some of these levels of nicotine are actually higher than an entire pack of cigarettes. When a person inhales their product, whether it's a cigarette or an e-cigarette, a vaping product, what happens is that nicotine is breathed in with the other chemicals, and very, very quickly that nicotine is released from the other chemicals, and it takes about 7 to 10 seconds for that nicotine to get up to our nicotine receptors in our brain. The nicotine receptors in the brain develops over the length of time a person is using the product, as well as how often they're using that product. The more they use it, the longer they've used it, the more nicotine receptors have developed in their brain. Once those receptors receive the nicotine, the person using the product gets a really good, feel-good endorphin release, a nice relaxation. And then about every 2 hours, their body and their brain starts to expel that nicotine, and then that cycle of craving, that addiction now happens. For adults, it takes approximately the equivalent of 100 cigarettes to become addicted to nicotine. For youth, it's a lot less because those nicotine receptors are actually in the same portion of the brain as that's still developing until a person is 25 years old. So nicotine specifically in youth, nicotine is dangerous and highly addictive for youth at any age because that brain is still developing, as I said, until 25 years old. Nicotine affects brain circuits that control attention, learning, mood, impulse control, and increased susceptibility to addiction and other drug use. In addition to nicotine exposure, e-cigarettes can be harmful due to the other chemicals or substances present in e-cigarette devices. For example, nearly 1 in 11 middle and high school students vape cannabis in the United States, and marijuana use was 3.5 times more likely in people who have vaped to those who didn't. Other substances are put into these vape products, including alcohol. So this, I wanted to talk a little bit about how do we determine how much nicotine a person is taking in if they're vaping. And why this is so important is because if you have someone who's vaping, who's interested in stopping, going through cessation in order to help them with nicotine replacement therapy, we kind of have to get a good idea of what they're taking in. So right now in the United States, there's approximately 2 milligrams of nicotine to every cigarette. On the left-hand side, we have a traditional pack of cigarettes, which contains 20. So therefore, there's 40 milligrams in a pack of cigarettes. Moving towards the right, this is a JUUL pod. One JUUL pod has 41.3 milligrams of nicotine, which is more than 1 pack of cigarettes. And again, these pods can be used at intervals quickly or slowly, depending on the user. They can be breathed in extremely deep. They can be held in the lungs longer until the person exhales. So really depends on how the user is using them to determine how much of this nicotine is actually getting absorbed. So the next pod over to the right is called a fix. That one actually contains 75 milligrams of nicotine, which is equivalent to about 37.5 cigarettes worth of nicotine. And Soren, this is our refillable pod. This is equivalent when it's full to 90 milligrams of nicotine, which is about 45 cigarettes worth of nicotine. So in addition to pod systems, as we saw on one of the first few slides I showed, we have something that is refillable, right? It's a mod, it's a tank, and we buy liquid in a little jar, typically that has a little pincher that you fill, you put that into your mod. If it's large enough, you can buy a larger jar, and it actually has a tip on the top that you actually pour into the tank. So now the question is, how much nicotine is consumed with these products? So the first thing we have to do over here on the left-hand side is we have to determine the daily product consumption. So the number of refills that you use of the capacity of the tank is how you find out the number of milliliters that you use. Then the second step is you have to calculate your nicotine intake. So the nicotine content of your e-liquid times how many milliliters from step 1 that you're using a day, get you your answer to nicotine per day. So this example that I provided down on the bottom left-hand side, this person is vaping approximately 4 milliliters of a 6 milligram per milliliter e-liquid per day. So we do the math, step 1, step 2, and it turns out that that person is taking in 24 milligrams of nicotine a day. This math is going to help us choose which kind of nicotine replacement therapy to help this person with. Will a patch work? Will gum work? Will a lozenge work? Will they need a prescription for another medication for cessation? And on the right-hand side of this slide, we're really talking here about the different strengths that are available right now in these liquids that, again, you refill into your tank system. And so your list is provided on the top of this section. And then on the bottom, I just gave an example. If you fill up a 5 milliliter vape tank with 6 milligrams of milliliters of e-liquids, you actually are taking in 30 milligrams of nicotine in your tank. A 10 milliliter bottle of the same amount contains 60 milligrams of nicotine in total in that whole product. So in addition to nicotine, what are some of the other hazards? You see on this video, you have somebody in a convenience store at a cash register. He's just buying something while he's there, and all of a sudden his vape pen starts exploding in his pants pockets. We have found that there's defective e-cigarette batteries that have caused fires, explosion, and life-threatening injuries. Part of the problem is a lot of these products that we buy do not come with instructions on the fact that you can overcharge them, which is part of this problem. Exposure to liquid nicotine in itself can be toxic if it touches your skin or if you swallow it. And children and adults have been poisoned by doing such things, swallowing or absorbing the e-liquid. E-cigarettes or vaping, product use associated lung injury, EVALI. EVALI actually got its name only a few months before we had the COVID-19 outbreak. And what was happening in our country is that we had cases that we were recording of people that were actually hospitalized, and some of them dying with symptoms like cough and shortness of breath, chest pain, nausea, vomiting or diarrhea, fatigue, fever, or weight loss. And after some time of monitoring these illnesses, the name EVALI came to be. EVALI cases in the country in February was about 2,800. Now, the reason why it stopped its counting in February is because of COVID-19 and the precedent of this particular illness. So that our head count for EVALI cases sort of went on back burner when COVID-19 came in. Some theories for these causes: in all cases, some kind of vape product was in fact used. Vitamin E acetate and black market cannabis also has been found in the people that have had this EVALI. Other concerns are linked to seizures and cardiovascular disease, as well as depression. When EVALI was given its name, the CDC actually came up with advice on how to interview the patient that had these symptoms, what kind of physical examination should be done, and perhaps some lab testing and imagery. So if you have a patient that's presenting that has some of these symptoms that we just said in the last slide, you definitely want to ask about e-cigarette use or vaping. Are they vaping nicotine? Are they using THC products? You have to make sure that they know, particularly if it's youth, that it's confidential and it's not judgmental. You really want this person to give you concise information about what they're using, what other symptoms they might have. And then again, going through with the physical examination, you want to look at their vital signs and their pulse ox. And if you find necessary, some things like a chest x-ray, et cetera, can be done as well. And on this slide, which you will receive, there's actually a link to much more detailed information about how to screen for this. In addition to that, on that same link, we have what do you do about reporting if you have a patient that has these symptoms that you feel that has EVALI. Basically what you're going to do is you're going to work with your state health departments and you're going to report that case, and then your state health departments are going to notify the CDC about these possible cases so they can be tracked. So years ago, there was something called the Master Settlement Agreement in the tobacco world. And that's when the FDA won the regulation rights for marketing the e-cigarettes, for labels on the e-cigarettes, for the rest, regular cigarettes, and also the content of the recipe of those cigarettes, including how much nicotine is in every single cigarette manufactured here in the United States. So some of the things that happened was they could not market cigarettes in magazines. You couldn't use cigarettes in an actor on the television or in movies. You couldn't advertise your cigarette sales more on certain percentages of your windows, etc. Unfortunately, that master settlement agreement does not cover these e-cigarettes products. So it's really still an unregulated industry. Again, the FDA is working on regulating this industry. Nicotine concentrations and other contents, therefore, are not the same. We can still see online sales. They have been cut off to minors, but we all know if we go online and we check the box that we're 18 or over or 21 and over, you're still going to be able to get through that process. Many of these products are made overseas. And also, if you look at the picture on the bottom left there, the advertising still continues for these products. Now, this particular example is on the left-hand picture. That's a Virginia Slims advertisement from many years ago. The same company that manufactures Virginia Slims also manufactures blue e-cigarettes. And Blue e-cigarettes dusted off that old magazine ad, and in fact is still using that ad today. And again, these marketing tactics were very, very similar to other tobacco products. They also very misleading claims about being healthy and safe. So what's come out of the FDA working on regulation, it is now prohibited to say that is water vapor or that is safe and healthy. That language is not supposed to be there. Also, it was marketed as a cessation device before we really were able to test it as one. And so now it's also prohibited to say that you can quit smoking by using these devices. And we'll see later on how when a person initiates using these devices that had never smoked a cigarette before, becomes addicted to the nicotine, and may then turn into both a dual user, other nicotine products, other tobacco products, as well as an e-cigarette. They promote that e-cigarettes can be used anywhere. In the state of New Jersey, in 2010, there was an amendment in our 2006 Clean Indoor Air Act that prohibited the use of these products inside, and many states have followed since then. And they've been proven to increase use by youth, by candied flavor products that we saw before on another slide, themes of rebellion or glamour, which we see here on these left-hand pictures, sexy celebrity endorsements, sports and music sponsorships, and coupons and discounts to help people buy the products. Right now, over 5.4 million youth are current e-cigarette users. 1 in 4 high school students and 1 in 10 middle school students are using these products. And e-cigarettes have been the most commonly tobacco product used among youth since 2014. And you see here on the right-hand side, again, this is an advertisement. Just look at the way this is laid out. This is somebody's desk. You have a notebook there on the upper left-hand corner. You have a pen and a sticky note on the bottom left-hand corner. Of course, you have your computer on the right with a little sticky note that says they need to study, they can go buy some groceries, they're going to go to band practice, and then they're going to have vape time. And you can see right there the vape product right there in the center, and of course where to go buy them online. In 2019, more than 1/3 of high school e-cigarette users now report using it 20 or more days per month, while 18% of middle school users report using such frequency. So not only are they using the products, but they're using them more and more frequently. That again speaks to that nicotine addiction. In 2019, 64% of high school students who used e-cigarettes reported using mint or menthol flavor products, and that's a 13% increase from the year previous. This slide shows us our national youth use. So any tobacco product at all is 31.2%, and look at that line for e-cigarettes. It's 27.5% of any product at all. The one thing I want to talk about is that hookah use right now in the United States among youth is down to 3.4%. But our last statistics done specifically in New Jersey has reporting 7% of youth use of hookah. So dual use, the vast majority of current e-cigarette users also are current smokers. 65% of the youth who have used an e-cigarette in the last 30 days also say they're using another tobacco product. This really raises concerns beyond the potential health effects of e-cigarettes alone, because when this person is talking about perhaps cessation, perhaps thinking about illnesses, it's very hard to decipher where we start with this, how much nicotine a person is taking in, what happens with when they're using a cigarette. The cigarette has 7,000 chemicals and all the illnesses associated with cigarette use, versus an e-cigarette, which has less chemicals, but we've seen has more nicotine. So having our head wrapped around that, helping these kids learn about these products, learn why it's difficult to help them stop using these products if they're dual using. Research suggests that using e-cigarettes may lead to start using traditional cigarettes. And again, that is all about that nicotine addiction. These products are fairly expensive. Sometimes they have good sales that are going on, but what happens is that they use these products, they get a hold of them somehow, they become addicted to the nicotine, then they can't refill their product, they can't buy their product, maybe they don't have the money, etc. So it's easier for them and less expensive for them to try to buy some cigarettes and then use that to get their nicotine fill. So young adults ages 18 to 24 is actually the highest adult group that are using these products. And even in this adult range, 40% of them were never smokers to start with. So they're initiating with these products. 43% were current smokers, 17% were former smokers. Young adults who use e-cigarettes are more than 4 times as likely to begin smoking traditional cigarettes in a short amount of time, only about 18 months. So adult use, you can see on this slide, if you looked on the left-hand side, our adults after our 25 to 44-year-old age range really drops off for anyone 45 and older using these products, and it almost doesn't exist after somebody's 65 years old. And then we see young adults who are using e-cigarettes every day really increased from 2012 to 2015, and those are those 18 to 24-year-olds. So that bump up is really concerning. 7 million adults do use e-cigarettes, and about 60% of adult e-cigarette users also smoke, which is that dual use problem. So as I said earlier in the presentation, these pod-based systems are really the most popular right now. The brand that happens to be the most popular continues to do so, although there's some more brands coming up in interest, is still JUUL. This warning that you see on the left-hand side here is actually the warning that is in fact on the website for JUUL. So JUUL has had this warning. However, if we move forward, 63% of these kids didn't know that these products always contain nicotine, despite having the warnings right on that website. And now they have warnings on their packages as well. JUUL users largely report using them because of fruity and sweet flavors. Of youth who used JUUL, 1 in 3 used marijuana with the device. And again, those are knockoff cartridges that they can use in that heating element. So where are these kids getting these products? It's 21 years old in order to be able to buy them in New Jersey. It's now also 21 years old in order to buy them nationally. 74% of them are saying that they can still go into a physical location and buy them. 52% of them get them from a social source. So a social source could be a friend, could be or another relative, could be someone going into a store and they ask in a parking lot to buy them. But interestingly enough, unfortunately, we still do have parents actually buying these products for kids. Parents are getting the indication that since so many kids are using them, that it must be safe, and so they go ahead and let their kids use them. And 6% of them do buy them on their internet. And while the internet was not the most common, 89% of the youth who attempted online were successful buying them online. So a couple of updates from JUUL. In 2018, tobacco giant Altria has invested $12.8 billion for a 35% stake in JUUL, and the company at that point was valued at $38 billion. So, you know, we have to think about why maybe that happened. JUUL actually was getting a lot of feedbacks. They were actually being sued by programs like the American Academy of Pediatrics, the American Lung Association, particularly because of how they were attracting kids with their flavoring. And so what happened was when this Altria took the 35% stake, the benefit for the owners of JUUL is that now they have accessibility to the legal team, to the marketing team, to the brains behind Big Tobacco. Then in November of 2018, temporarily removed pods in retail stores except for mint and menthol and tobacco. So they took out those fruity flavors, which was so attractive to youth, from retail stores, but not online. In September of 2019, JUUL CEO resigns and was replaced with a tobacco executive. They also suspended all advertising and they stopped lobbying. And we also need to make you very aware, if you look on the bottom of your screen here, competing products that resemble JUUL devices and counterfeit pods are really on the rise. Some of the names are Miley, Candy Pens, Ruby, and Vuse. And if you can see here, all the way over on the bottom right side here, this is actually pre-filled THC, and it looks very similar to these other products. So some more images of popular products. This product over on the left-hand side is actually a watch, a real working watch, that this piece here, right here, is actually a tank. It's actually a refillable, rechargeable tank that people put their liquid in and they vape from. And this uses a nicotine salt, so when they express the air, you really don't see it. So you think about where this can be used, both adults and youth, inside very readily. So we can think about, there's a real correlation of, sitting in a bar, having an alcohol beverage and smoking or vaping. Now people can do that inside and not really be known to people that are sitting around them, as well as kids in school can use this. Then in the center top, this again is that Soarin' drop. Now this Soarin' drop, again, this top here is the refillable portion. And this actually looks like, I don't know if any of you that are listening could see that it looks like a highlighter. Years ago, the highlighters came in this shape, and it actually is the size of a palm of your hand, so it can be very easy disguised. And then down here on the bottom, the reason I chose to put this image on is because we have actually found this product in a Wawa store for 99 cents. A person can buy the actual product for the heating element for 99 cents. And then the refills there on the left part of that Enjoy is actually about $19.99 for a pack of 2. And then all the way over on the right-hand side, this is starting to become more and more popular. It's just called Moti. And this, you can see, comes in all different colors, all different personalizations. And this is a pre-filled product as well. So now that we talked about youth and using and how frequently this is and how concerning it is for this age group, the Surgeon General's office actually came up with a Talk to Your Teens product. One of the big things is that as a parent or caregiver, is really important for you to have your role in protecting your children from e-cigarettes. So we got to get on board to know that e-cigarettes are dangerous. We still don't know to this day exactly what people are taking into their lungs, but we do know that EVALI exists. So we need to make sure that we're talking to these teens, letting them know the facts, that we're not judgmental. Why is it harmful for them? It's never too late for them to stop. Set a good example by being tobacco-free yourself and certainly vape-free. Learn about the different shapes and types of e-cigarettes and the risks of e-cigarette use for young people. And again, this link is going to be there for you when you get this PowerPoint. We all can send a message in the roles that we play to people using these products. And it's us at this point, all of us on this webinar, that have to counteract the advertisement that's still allowed to go on for these products. So let's talk a little bit about state and local action. In 2010, New Jersey's Smoke-Free Air Act was revised to include a ban on electronic smoking devices in indoor public places and workplaces. And to this day, there is still people using them inside in New Jersey, but in fact, since 2010, it's been illegal. And again, it's up to us that learn that information and know that it's a law for us to impart that information if we ever see it going on inside. The age of sale in New Jersey to purchase e-cigarettes increased from 19 to 21 in 2017. In 2019, New Jersey public beaches and parks banned smoking and vaping throughout the entire state. And then in 2019, the New Jersey governor created a task force to investigate electronic nicotine delivery systems. And I do have the link there for the full report. And then in January of 2020, New Jersey, the first state in the nation to impose a permanent ban on flavored vape products. And I have the legislation number here if you want to look it up. It does prohibit the sale and distribution of flavored vape products, including menthol. So that was very exciting. And then federally, in 2016, the FDA is approved to regulate all tobacco products, which includes our electronic devices. Manufacturers and retailers must submit a pre-market review application by 2018, which was what the agreement was back in 2016. Unfortunately, for a number of reasons, And now because of COVID, actually, this is now pushed back to 2020. So what this looks like, if a person is making a product or selling a product, they have to fill out an entire application and send it into the FDA. The FDA is going to take all of the applications that are sent in and review them and be part of the national decision on how they are going to control the marketing, the making, and the distribution of these products. In addition to this, very quickly in 2016, they did regulate child safety caps, and that did happen. So initially when the refillable tank jars were made, they were just made wherever people wanted to make them. So in their little shops, in the back of their houses, bringing them in for overseas. And so what the jars that they were putting them, none of them had child safety lots. And in fact, we did see poison control calls really spike in 2013 and 2014, with children actually getting a hold of these products and being able to drink them because they smell good and they taste good. So that has all been controlled, and we have absolutely seen a decrease in those calls to poison control. In 2018, all covered tobacco products must bear the required nicotine addictiveness warning statement on product packages and advertisements. And if you see the picture that I had of JUUL's packaging several slides back is actually an old picture of that. And in fact, JUUL is one of the companies that abided by this, and they do have that labeling on their products. And several other products that I've seen has that as well. And then on December 20th in 2019, the president signed legislation to amend the Federal Food, Drug, and Cosmetic Act and raise the federal minimum age of sale of tobacco products from 18 to 21. So let's talk a little bit about when you're working with your patients or your clients and you talk to them, you assess them, you're asking them about the use of these products, then what happens from there? So right now, Mom's Quit Connection, New Jersey Quit Line, and the New Jersey Quit Centers all are helping kids and adults quit using these products. So the New Jersey Quit Line is a free telephone-based counseling program for New Jersey residents 18 and over. They are opened every single day, and you can go on newjerseyquitline.org to get the hours of operation. People can either be referred in from their provider, and the next webinar that's coming up, we'll talk a little bit about that in a couple of weeks. And then also they can self-call in the toll-free number. Right now, we also have access to a portal for New Jersey residents at the New Jersey Quit Line, and they also receive educational material. And then Mom's Quit Connection for Families, Quit for Kids, is a program that operates right here in New Jersey. And that program actually sees either pregnant women or young families with children 7 and younger. And this program is a little bit different in that there is no maximum amount of visits a person can make to the system. This is either a telephone or an in-person based program. They have adapted their program currently to be all telephone cessation. It's one-on-one, and it is unlimited sessions. And then you can see there the person can call the toll-free number. We also have a Quit for Kids texting support program. And for that information, you can go to quitforkids.com. And then our New Jersey Quit Centers. So our New Jersey Quit Centers are up, we have 11 Quit Centers and that are sees 12 counties across the state. And to see if your area has a Quit Center, you can go on tobaccofreenj.com. So additional cessation programs outside of New Jersey, we have a national Quit Line and a Quit app. We have a free texting program specifically for teens. So for vaping, they would, it's the Truth Campaign. And then for smoking, it's Smoke Free Teen. And then online quitting has become an X. And then we also have another app called Free Apps Quit Start. So anybody on this call, this slide is national programs. It's not New Jersey specific. The previous slide is New Jersey specific. Again, if you're outside of New Jersey, I would highly recommend probably your Department of Health website would have a list of programs specific for your state, such as Quit Lines or Quit Centers. So a lot of hospitals have hospital-based cessation services as well. In New Jersey, we currently right now are having a program, Tobacco Free Ride NJ, Clean Air for Kids in Cars. So we need to think about who's using these products, who is vaping, who might then have secondhand vapor exposure. So we want to make sure our young kids and that go in cars with people who might be using, or just have adults in the car, that these adults are making a pledge that they're not going to use these products in an enclosed car when someone 18 or younger is present. And right now we are collecting all of these pledges. Our goal is to get 500 pledges. We are up to about 330 pledges right now. And the first 500 pledges actually get a smoke-free car kit. And in that kit is a flashlight and a tire gauge and a first aid kit. Additionally, again, our New Jersey folks that are on the line, I want to make sure you know that Medicaid, New Jersey Family Care, covers the cost of all 7 FDA-approved cessation products. So those products include over-the-counter products. The thing with the over-the-counter products for a Medicaid recipient, New Jersey Care person, to receive them for free is that they must have a prescription from a provider to show to the pharmacist to get that product for free. And additionally, I want to let you know that we have this smoking cessation provider toolkit update on NewJerseyQuitline.org. And this is coming soon. It's not quite there, probably within the next week to 2. This whole website has been revamped to include a lot of information on electronic nicotine delivery systems, more education opportunities, as well as this particular provider toolkit, which also has a lot of resources in there for electronic nicotine delivery systems. The other highlight I want to give is that New Jersey has Vape Facts NJ out of the New Jersey Department of Health. And this gives you a lot of, again, current information, good links to the CDC, to NIH, et cetera. Also talks about EVALI and also talks about our EVALI cases specifically here to New Jersey. And then again, tobaccofreenj.com. That is also part of Tobacco Free for a Healthy New Jersey. And they have a lot of resources regarding vaping, including don't get vaped in training for providers, for school personnel, et cetera. And then we have our youth program called incorruptible.us, and then additional resources beyond that. And we have here that we've gotten to the question slides.
All right, thank you, Cathy. The first question, smokers are more susceptible to getting COVID-19?
Yes, so if you saw on the very first slides that the World Health Organization as well as the CDC is saying that because of one, the hand-to-mouth action from taking a cigarette or a vaping product and putting it to your face, possibly touching your face, that raises the likelihood of somebody contracting COVID-19, of course, if they are exposed on their hands. And the fact that smokers and e-cigarette users already are compromising their airway system, their lung system. When we think about some of the symptoms of COVID-19 with pneumonia, there's a direct relationship there. So if you go back to those first several slides, or if you want to go on the World Health Organization or the CDC, that's where that information is from.
Next question. Does a table about use of tobacco products include marijuana placed in a blunt or cigarette?
Does the table, read that one more time for me.
So I guess you had a list of all the tobacco products, so I think she's referring to that. Does the table about use of tobacco products include marijuana placed in a blunt or a cigarette?
No, it does not include marijuana specifically.
Next question. How do you regulate the use of vaping when states are pushing to legalize marijuana? Is vaping increased in those states with legalized marijuana?
So I can't speak to those specific states because I am very New Jersey specific, and that is something that is on the table for discussion all the time when we talk about marijuana use, the increase in marijuana use, and the fact that marijuana can be used in these systems. So we can tell you, based on our research and knowledge, that yes, people are using marijuana in these systems. And if you look at that slide again about EVALI, EVALI definitely has a high percentage of those positive cases of people using such products in their vaping tools, whether it's a mod or etc. The other thing is the pod-based systems, people that are using them, they've been able to figure out how to take the tops of those off that are supposed to be disposable and replace the product or refill it with THC.
Besides cervical recession, what are effects on dental patients?
So the big thing to look at for dental patients is what's happening inside of their mouth. And oral cancer is very, very common with these products. So we want to look at under their tongue. We want to look at the insides of their cheeks for any indication of things like other gum illnesses and oral cancer.
Also, soft tissue evaluation will be done similar to the regular patients for oral cancer exam?
That I think I want Sam to answer.
I'm sorry, can you repeat the question, Brian?
Also, soft tissue evaluation will be done similar to regular patients for oral cancer exam?
Yes, I think you would evaluate the soft tissues similarly and be looking for the same kind of stuff for somebody who's vaping, that you would be looking for in a smoker.
All right, we're going to go to the raised hands. Jean, I'm going to let you allow to answer your question. Go ahead, Jean. I believe you are on mute.
Okay, hold on. Okay, I'm unmuted now, yes. The thing about adults over 65, not an issue, well, it was an issue for my brother-in-law, 87 years old. He collapsed. We thought he had a stroke. Took him to the hospital. What he was doing was vaping on his marijuana, and it wasn't having an effect. So he kept on sucking it in, and finally he collapsed. So, I mean, this is unbelievable because this is an educated man. He was a teacher, musician. I mean, I can't believe that somebody, because it was free apparently, and he could get it from his doctor, he had that senior citizen mentality. Well, let me take advantage of this. This is crazy. So I just wanted to share that with you because that's how dangerous things are.
Thank you very much for sharing. And you're absolutely right. We have to remember that the data and the statistics are, combined over a certain period of time in a certain data set, but there's always going to be examples exactly like you're telling. And thank you for sharing that because I think people on the line need to really realize, again, like you said, how dangerous these products are and unfortunately how readily they are either given away or now they actually have CBD oil pens already pre-filled like that, and sometimes people are using them for aches and pains and feeling like it's okay to use because it's medicinal. So thank you for sharing.
Thank you, sir. Next question. Are you aware of research on effects of vaping on oral health?
So I don't have that research right in front of me. I can absolutely get that research and I can hand it over to the host of today and we can get that out to everybody on the line specifically for oral health. Do you want to add anything, Sam?
Nope, I think that's good.
Okay.
Next question. Are all New Jersey school teachers getting info about these products through these important courses?
So thank you for that question. Tobacco Free for a Healthy New Jersey has a program through the New Jersey Prevention Network, and it is called Don't Get Vaped In, and it's a free train the trainer program that is now going to be done virtually for all school systems throughout the entire state, that they can send one or multiple people to the training. We did these trainings last year. We're going to continue them this year. And then from that training, they're given a whole curriculum, and the curriculum includes an adult-to-adult curriculum. So for that staff person to teach other staff people as well as parents And then we have an adult to youth curriculum that could be used in things like, for example, health classes. And then we actually have a youth to youth cessation program, because we also know that a peer-to-peer method works with this age group. And all of that is inclusive in going to the training. When you go to the training, you're actually giving access to a portal online. So as new material becomes available, you can go on that portal and get that material. And in addition to that, we also have a program called Aspire from MD Anderson, Texas. That is a non-punitive education measure that we're asking schools to actually put into their policies. We also have sample policies, and we worked with a program called Legal One for that. And we also have continuing education. For example, there's a program in northern New Jersey that has ongoing education. We have 3 regional partners, Northern, Southern, and Central, and they provide education. We also have tobacco-free collaboratives in each region that you can join as well.
All right, thank you. 2 more questions. Looks like more questions coming through. Can teachers ban the students carrying these different fancy-looking vaping products?
So that actually must be in your school policy. From my understanding, there's a lot of schools right now that do take the products away from the students when they find them on the student. Unfortunately, my understanding again is that they cannot dispose of them because they are property of the student. They must call the parent to say, we've confiscated this product, and the parent has the option to say dispose or come and pick it up.
Thank you. When CBD sprays and creams for pain control are being legalized, can these products also be mixed along with vaping by students without knowing the consequences?
I'm sure, yeah. So the thing that we have to remember about these products is that it needs to be in liquid form in order to go into this product in order to be used. Now, what's happening with the CBD oil is that it is much thicker than the e-liquids, and that's where some of these lung illnesses associated with these products are coming into play. But yeah, I mean, students find a way to use them, absolutely.
All right, thank you. We're going to switch over. Jean, you had your hand raised. You have now been unmuted.
Thank you. Well, Cathy, thank you very much. I'm the state director of the Future Health Professions program in the state of New Jersey, and it's called Health Occupation Students of America. We're going to have an international convention in June. It's going to be done virtually. And the Catch My Breath Foundation, if you've heard of them.
I have.
You have, good. They are a finalist along with pediatric cancer, and I think it's organ donation. Those 3 are going to present to the students. Usually we have 12,500 people at this conference convention. So they are the finalists for the next 2 years in developing a service project. So every 2 years we have an international host a service project. And students at all these chapters all over the country, and then in other countries as well, raise money and advocate against whatever the service project is, or for the service projects. In this case, if vaping is decided to be selected through Catch My Breath, that's wonderful, because along with that, I'm sponsoring a poster contest for $500 for 3 awards to the students with the best posters. That'll start just after May 15th, and it'll go through June for 5 weeks. It'll be announced at this international virtual conference. So the point is, can I consult with you and ask you for input so that we can make the presentation that Catch My Breath gives to the students a better presentation so that it can be accepted as the service project over the next 2 years?
So my email is on the slide that you're seeing right now. Why don't you email me offline, and if there's a way that I can help you, I certainly will.
But I am excited about that because I'm in a position where we can do something, and it's certainly, it's a lot of work, but it's worth it. Thank you.
Thank you.
NIPC.
All right, thank you, everyone. The rest are just comments, so we will put those in an email for later. I'm going to pass this over to Dr. Joaquin.
Yes, thank you so much, Cathy, for an excellent and very informative presentation as usual. As a reminder, attendees will receive a SurveyMonkey link following today's session. Please stay logged on and complete the survey to receive your CE certificate if you are seeking dental credit. CE certificates for today's webinar will be sent out the week of May 25th. Cathy will be back with us on May 13th to present on the CDC's evidence-based best practice brief intervention model, Ask, Advise, and Refer. I hope you could join us again at that time. For additional questions or information about today's presentation or future programs, please feel free to contact me at swakim@zufallhealth.org. Be well, stay safe, and enjoy the rest of your day.